let's go to our next item on the agenda, which is special commentary. Dr. Swift.
Thank you, President Johnson and trustees. We're delighted to welcome this evening I want to make sure I say the name correctly, Annette Sobosinski, I believe it is, from Child Care Network. We just really appreciate our outreach with Annette and her willingness to come and share with the board in the presence of the community some of what they do at Child Care Network and the services that they can offer in support of our students and parents and families.
Well, thank you so much for inviting me to be here today. I appreciate the invitation to share more about our agency. And again, my name is Annette Sobosinski, and I am the Executive Director at Child Care Network. We are a local nonprofit organization. We have been around actually since 1971. We're celebrating our 50th anniversary this year. So I'm excited to tell you more about what it is that we do. Our mission is to promote the success of children, families, and our community through quality childcare, education, advocacy, and family support. We originated in Washtenaw County, but we do serve an additional 6 counties beyond Washtenaw County. We are a regional organization. So what does our mission mean? This is our really quick elevator speech about what we do. We help families to find childcare. We help families to pay for childcare, and we help childcare professionals provide quality childcare to the children and families that they serve. So we do that through several different programs. The first program, and really one of the most pertinent for tonight's discussion, is we are the Great Start to Quality Southeast Resource Center. Great Start to Quality is the state's database and quality rating and improvement system for all licensed providers in the state. And we are one of 10 resource centers that supports both childcare providers and families. So we have resources and trainings and consultation and lending library resources that support childcare providers with improving quality. And then we also help families. We use the Great Start to Quality system to help families find childcare that meets their needs. In Washtenaw County, this is a slide that demonstrates the current types of care that are available. I like to talk about this because not everybody knows about all the different types of childcare that is available to meet families' needs. The first on the slide, that we have the most of in Washtenaw County, 184 of them, licensed child care centers. And this is what people typically think of when they think of a child care. This is a facility that's not a private home that is licensed to care for one or more children. And often they'll have multiple rooms for care. They can have different age groups, and their capacity is usually based on the square footage of the space that they have available to them. The next type of childcare program is a licensed group childcare home. There's 54 of those in Washtenaw County. This is a private home licensed to provide care, early learning and care for up to 12 children. And then again, licensed family homes, also 54 of those, and that is a private home license to provide care for up to 6 children at a time. The other population that I like to talk about is the license exempt population, and this is the one that most people are not very familiar with. Families who qualify for public assistance from the state of Michigan to help pay for care, the Child Development and Care Subsidy, or CDC subsidy, sometimes can use family members, friends, neighbors, somebody who can help provide that care to them, and they can get reimbursed through the state of Michigan for providing care. There's a process that these providers have to go through, a training that they take through us, focused on health and safety, child development, and CPR training. But this is a population that some families are able to use. And then this last category, which we don't really have any way of estimating the total number in this category, but this is people who use informal family, friend, and neighbor care. We think this is a lot of people who use this form of care as well. So these are the types of care. The next slide will show the number of programs and the capacity of those programs specific to Washtenaw County. One caveat that I will say is that this data is based on providers self-reporting in Great Start to Quality. So it relies on providers themselves to identify their current status. This was a feature that was started during the pandemic so that people could easily see which programs were open to provide care during the pandemic, which were temporarily closed. So you can see here that according to data I pulled yesterday, actually, about 76% of all licensed programs in Washtenaw County have identified that they are currently open and accepting children. 11% have identified that they're temporarily closed, and about 13% have not submitted data. So we don't know their status, although we think there are some of those programs that are actually open. They just haven't reported that they're open. But many of the programs are also school programs. Sometimes they're religious programs that just have not updated their information in Great Start to Quality. The next program that we have that I'd like to talk about is our family support program. Our family support program is the program that we use to help families pay for childcare. So this is essentially a childcare tuition scholarship that can help support families with the cost of care. And it supports families who earn up to 250% of the federal poverty level. So this includes families who sometimes qualify for that state subsidy that I talked about earlier, the CDC subsidy, but that's not enough to cover the full cost of care, or it also can support families who make above income and they don't qualify for that subsidy, but it's still, they still need support paying for care. We also have several community programs that we offer as well. Excuse me, we are a MyBridges community navigation partner. And what this means is that when families need, or individuals, anybody needs help or assistance applying for state benefits, whether it be the child care subsidy or food benefits or cash assistance or any of those things, our staff are trained in helping to support them with completing the application process. Currently, our organization is not open to the public because of the pandemic, but when we are open, we do have a computer and people can come in and use that computer to apply for benefits. We also have been involved in the Mom Power efforts in Washtenaw County, partnering with the Washtenaw ISD and Michigan Medicine and supporting families with young children, parents of young children in learning more about protective factors and strengthening those families. We also offer a lot of online training that is available not only to childcare providers, but anybody who's really interested in learning more about caring for kids or child development or trauma or lots of different things like that. So this is a picture of our Washtenaw County office. We are located on Research Park Drive in the same building as the Ann Arbor Center for Independent Living. Again, we are not currently open to the public, so we encourage people to call or email us if they have need for our services or support. But this is where we're located. These are just a few of our partners. We work very hard to blend funding streams together from all different sources in all of our different counties to really support all of the work that we do. So we always like to show a slide that demonstrates just a few of those funders and how they support us. This is not an exhaustive list. And then I always like to share a picture of our staff because the staff are the ones who are supporting children and families and childcare providers and really are dedicated to providing excellent customer service to those that we serve. So wanted to share that. And last, just a thank you again for inviting me to be a part of the meeting tonight and sharing our services and programs. And I'd be happy to take any questions if there are any.
Thank you very much. Trustees, any questions? Trustee Dupree.
Hello. Thank you so much for coming and giving this presentation. I'm very happy to be able to see all the services that are available to our community right now. There's one question that I had. I think it came from the last meeting and it's been coming up pretty frequently. around transportation. Now, the original conversation came up about before care and after care. And really the convenience of before care and after care is having your student in the building, so you don't have to risk being tardy or anything like that. So I wanted to know if you had any information on how many of your service providers actually provide transportation to parents, and just how they can get information on something like that.
Yeah, so I don't have the information off the top of my head, but that is something that you can search for within Great Start to Quality, or our staff can help to support families to search for that. I will say, just as a general rule, it is very few and far between that there are providers that are offering transportation, but I do know that, we've had conversations recently with some providers in the community, and they are thinking about ways that they can support the families who are in need of this type of care in the fall. So I don't know what that means. I don't know exactly what it's going to look like, but they are thinking about that. I also will say that I do know that sometimes if a parent can identify a provider and it is in the school district, and the school district offers busing, then it sometimes is simply a matter of just changing the address of where the child would be dropped off if the family if the provider is within the district and can get kids off of the bus. So that's one option that I know I've heard of some people using for transportation.
That's a really good idea. I actually didn't think about that. So I guess one more question I had, you mentioned the use of the DHS child care subsidy.
Mm-hmm.
If you go onto your website, do all the providers accept the child care subsidy, or is there a way to search and see which ones do?
Yeah, not all providers do accept the child care subsidy, but that is one of the search criteria on Great Start to Quality as well. Yeah.
Thank you.
Mm-hmm. Sure.
Thank you. Trustee Basket.
Thank you, Annette, for joining us, and I really appreciate you making the time, especially since this is your day off, and I just wanted to acknowledge that. So thank you for making that time for us. A couple of questions. First of all, people are very anxious about finding childcare in the fall, and I appreciate that. Do you have any tips or advice for searching for daycare in the community?
Well, I think people tend to be pretty technologically savvy these days. So I think my first tip would be just to go to the website, www.greatstarttoquality.org, and just put in, whatever search criteria you're looking for. I would say, when I talked about those different types of childcare programs, the centers, the licensed group homes and the licensed family homes, sometimes people overlook those smaller licensed home providers, but really they can be a great option for families and for really good care for multiple age groups to support that if they offer the before and after school care. So I would say start there, start with the Great Start to Quality website. And if you're not finding what you're looking for, or you're having a difficult time, then people are welcome to call us or email us on our website, and we can support that as well.
Are you getting many calls?
Well, since the announcement first came out, we have gotten some calls. We have not gotten a huge influx of calls, I will say. We've gotten a few inquiries on our website and a few calls, but not a huge amount of increase.
So as I mentioned to you in our earlier conversations, I was once a licensed daycare provider, simply to solve my own solution of trying to find my own childcare for my son. And so I have some familiarity with what us daycare providers did during the summer. Sometimes we took the summer off. And so for your database, these are people, would you note that, and would a childcare provider note that he or she is not available for summer or for vacations?
They may, but as you saw from the slide that I showed, there was a significant population of providers who didn't update their profiles and
Right.
And to show that they were available. So really, sometimes it's a matter of looking on the site to see what's available and then making phone calls to those providers to see what their current practices are. Are they currently open and accepting children? All of that kind of stuff. So.
And I know there are new daycare providers always happening every day. How often, or how do I say this? How often should one look into the database for those new providers who may just be, just coming on, opening their doors? Or do you have a time frame of when they're expected to register with you, so to speak?
Well, as soon as they become licensed, they show up in the database. That's a state database.
Okay.
So as soon as they become licensed, they show up there. I'm not sure that I know exactly. But I will say this. I know you didn't ask this question, but it made me think of something else that I wanted to share.
Okay.
Is that if there are people that are interested in becoming licensed, we also support people with that as well. So.
That was going to be one of my questions, so I appreciate you mentioning that. So what type of support do you offer someone who's kind of noodling this? They may be laid off or maybe realizing that they need to look at other employment options, so to speak. How complicated, what technical assistance do you provide, and is it complicated?
Well, we can support, licensing is our first, people need to start with licensing, the actual state licensing site, but we can help them, we can help them access the licensing rules, help them understand what things are needed to get up and running, what inspections might be needed, all the different options that they need to kind of begin to pursue in order to get a license. So if they have questions about, what different things mean, we refer to our licensing consultants to help support that, but we also have some knowledge about that as well and can answer some of those questions.
Thank you. And last but not least, you're a nonprofit, correct?
We are a nonprofit, yes.
So I'm sure you're always looking for donations. We have families who are saying, who say that, they want to help. So how can a family who may not necessarily need the daycare services, but may want to help others get daycare?
Well, we are actually in the midst of our 50th anniversary fundraising campaign right now. So people are welcome to go to our website. We're currently trying to recruit recurring donors because that's, something that is helps to support us long term. And there's donate buttons on pretty much every one of our pages. So.
Great. Thank you so much.
Yes, thank you.
Thank you. Trustee Kelly.
Thank you. Thank you so much for being here tonight and for this presentation. I know this is really top of mind for a lot of folks. Great questions already by the trustees, but I just had one left over that hadn't already been touched on. When you showed the slide of what appeared to be openings and it tallied up to something like 12,000 openings, does that mean that that's how many children can be cared for in all of the people in your network, or is that how many seats are open currently that aren't already occupied?
Yeah, no,
available.
Yeah, that's. I'm so glad you asked that question. No, that is just the capacity of those programs. So what that number means is the number of children that each of those programs is licensed to take. It doesn't say anything about how many openings or how many children they currently have. It's mainly how many they are licensed to provide care for.
Okay, and do you have a sense of how much availability is out there? Are we at 95% capacity? Are we at 50% capacity? Where do you think we are?
It's really hard to say because during the pandemic, obviously things have shifted and changed, pretty much on a daily, hourly, sometimes basis, with initially providers closing, some providers staying open because they were caring for essential workers. So it really, really is all over the map. I can tell you that anecdotally, what we're hearing is that in some pockets of the county, there are programs that are completely full and have wait lists and don't anticipate any openings. But we have other programs that really are open and have spots available and would like to have, would like to be at full capacity. So, but I don't have a good sense of exactly where, it's just because things change so frequently.
Sure, of course. And is there an annual cycle to so kindergarten roundup always happens, in like February, March. Is there a predictable annual cycle to finding childcare? And where are we in that ebb and flow?
Not that I'm aware of. I know, just my own experience as a parent, I know I started looking for summer care in I'm not exactly sure of the answer to that question.
Sure. No, I appreciate that. And I know that things change all the time for families as well as the care providers. So I'm sure there's always a little bit going up, a little bit coming down, and it's
Yes.
all over. So
Yeah.
thank you again for this presentation tonight. And please keep us in the loop on how things are going. We know this is something that's really important to our families. So thank you.
Yes, thank you.
Thank you. Trustee Gaynor?
Yeah, thank you, Ms. Sobocinski, for all you do. Yeah, I had basically a follow-up. I think it's maybe more specific and you won't be able to answer it. But of course, the concern is, what is the capacity here in Ann Arbor or close by? And is it going to be sufficient to absorb the students that would ordinarily be in before and after school and childcare? Again, if you can't answer it, I understand, but I know that question is floating around.
Yes, I do know, and I have heard that question. And I don't know the answer to that question. I think it is, challenging to predict exactly how it would all play out. Families sometimes can, they may be able to find licensed care. They may begin to, connect with other families and determine other options. They may have family, friend, or neighbors that they plan to use instead. And families who qualify for the Child Development Care Subsidy can have state reimbursement for those situations. So it's really hard to predict exactly what this would look like in the fall.
Yeah, because you mentioned, I know there's been discussion about neighbors helping each other out. If they want to know the legal requirements, what's okay and what's not okay, is there a source for them to find out this information about?
In terms of like informal arrangements or?
Informal arrangements. Is there any point where they need licensing or where it's legal or not illegal?
Well, the legality of it is related to the pay. So like if it's informal situations where people are helping each other out and supporting each other with care, then I'm not aware of any legal issues with that. But somebody who, I'm trying to think of what the exact requirement is. I think it's above $600 in a year if they're earning that, not in like a nanny situation, but like providing care in their home, then that would be a situation where it would be considered to be illegal care. So,
right.
But if it's just families supporting each other, figuring out solutions in that way, then I'm not aware of any legality issues.
Do you happen to know what departments that people could look for to find out more information about that?
About becoming licensed?
Or what's required, or if it's $600, that's clear, but just all of the licensing.
Yeah, so it's LARA. It's called Licensing and Regulatory Affairs. It's a state of Michigan website, and they have the licensing rules for all 3 types of licenses that I shared right on the website, so you can look and see what the licensing rules are, what they require in terms of space and staffing and all of those things.
All right, thank you very much.
You're welcome.
Thank you. And did you say that you have like consultants or people that help to walk folks through that process if they're interested in becoming?
Well, let me click. Yeah, I'm sorry. Let me clarify that. There are licensing consultants that work for the state of Michigan, and they really are the starting point for that. But when people are going through that process, often they have lots of questions or, things like that. And so, yes, our staff, our resource center staff do know a lot about the process and can answer some of those questions or can direct them to licensing consultants, specific licensing consultants to help support any specific needs. Awesome.
Thanks. Trustee Lazarus.
Thank you. I was wondering, as a entrepreneur myself and people who are looking for making some money, how long, can you give us a general idea of how long it would take to obtain a license for the licensed family child care home? Like, is that something that is generally a 90-day process, 120-day process? What is the normals? Because if I was trying to figure out, okay, I want to provide some childcare for the fall in September, can I get my license in time?
So the main thing that really depends on is whether or not you really have licensable space. So for somebody who has licensable space already, you have a place located within your home that already is set and ready to go to be licensed, then yes, I definitely believe somebody could be licensed by the fall. I don't know exactly what the amount of time it takes. It depends on a lot of different factors, but I do believe it could take place by the fall.
Okay, thank you.
Mm-hmm.
Thank you, trustees. Great questions. Any more? All right. Well, not seeing any. Ms. Sobocinski, we really appreciate your time tonight. Great organization that you have, and it sounds like if there are questions, first thing to do is contact you all, and then you can point folks in the right direction. So thanks so much for that.
Yes, thank you.
All right.
Thanks again.
Yes, thank you
Appreciate
again
it.
for the opportunity. Appreciate it. Yeah, have a good night.
You too.
Excellent.